Good afternoon and welcome everyone in Dubai, the entire MENA region, and of course all those joining from all over the world to this session featuring scientists today here from Egypt and from Germany. My name is Alexander Niedermeyer. I will be the chair of this session and therefore also your host for this event. I'm from Germany, but I've spent the last couple of years as the DAAD long-term visiting professor at the Faculty of Economics and Political Science at Cairo University in Egypt. The topic of our session is the role of market and government intervention in addressing the COVID-19 crisis that has plagued us for more than 1 year by now. What we've been observing in this time is that governments have responded in sometimes quite different ways to the crisis, with some governments opting to intervene vigorously and others preferring a significantly lower profile. The presenters today will discuss the varying approaches taking a distinct stance on political, economic, and social aspects for society in general and for the respective health systems in particular. They will also try to discuss and evaluate differences between the approaches of high and low income countries and look into differences that might be caused, for example, by various types of government or governance. A central feature of this debate will be whether powers have actually shifted back to the governments and thus challenge the long criticized role of neoliberalist market orientation or not. And furthermore, if they have, will big government be really a viable solution in this crisis and beyond? So let us see and listen to the arguments of both the teams presenting, on the one hand, arguments in favor of free market solutions, and on the other hand, arguments in support of big government and distinct market intervention, and see how the evaluation of both of them goes. The format we choose for this panel is the form of a debate, which will take place in 2 rounds. In round 1, we will see the presentation of arguments of both sides. In round 2, we will see how each side replies to the arguments of the other team, maybe taking up a little bit of the criticism, so. And as a matter of fact, you as the audience will be playing a significant role as well in our session. You will be asked on your opinion on the issue of a return of big government before and after the first round of presentation, and again after the second round. So the first round of the poll will go out right now. I start here. The question, in your opinion, the role of governments worldwide has moved into more central during the COVID-19 pandemic, and you're more than invited now to join, so you can see that on your screens. And as this happens, I will introduce our presenters for today, but before I do this, I also want to introduce our professional judge for this discussion, who will be confronting the presenters with critical points in their arguments, but of course also underscore which argument was particularly convincing in the presentation. So let me welcome Professor Dr. Theocharis Grigoriadis, currently Professor of Economics at the Free University of Berlin, Germany. He is an economist and political scientist, so he is very knowledgeable about political as well as economic arguments, and also, since he's a legal scholar, he is not only competent in fairness issues, but also impartial, and he can also evaluate the legalistic arguments. So I'm very happy to welcome you from Berlin, Dr. Theocharis.
Thank you very much, Dr. Niedermeyer, for this wonderful invitation. It is a great pleasure for me to be here and establish the relationships between Berlin and Cairo academically and contribute to this amazing global event as a judge.
Thank you. We are so happy having you here. And now let's see who our presenters will be. We have Kulthum Essayed from Egypt, bringing 15 years of experience in public health policy making, in low and middle income countries. She provided policy advising for ministers of health in Egypt. She was a member of the Egyptian Higher Committee responsible for drafting the Universal Health Insurance Law. She managed public health programs. She worked for the WHO Regional Office for the Middle East to support the evidence to policy-making program. And the next candidate here is Yara El-Hamaili, also from Egypt, bringing more than a decade of experience in labor and health economics research and policy advising. She assisted in organizing a series of workshops and debates in the World Youth Forum 2018 and 2019. She worked with the WHO on health protection for informal workers, and currently she is working on creating a transformed labor market information system that includes informal workers, which the Ministry of Tourism, amid the efforts of the Egyptian government, to support the workers. Then we have Rana Korayem, also from Egypt, the program manager of the Women, Peace and Security Program at UN Women Egypt. She started her career in professional development in 2008 when she joined the United Nations Development Fund for Women. Ms. Korayem holds a master's degree in public policy from the American University in Cairo with a specialization in social and environmental policies, and her research includes coalition building among women's movements, ending violence against women and Islam. Yara Shaheen from Egypt brings 19 years of experience working with various international donors, multilateral, bilateral, and non-governmental organizations in the fields of community development, human rights, and non-governmental organizations in the field of community development. So she has a Master of Public Policy from American University in Cairo with a focus on nonprofit management and capacity building of non-governmental organizations. Then we have Florian Friedrich. He is an advanced master student of political science at Friedrich Alexander University, Erlangen-Nuremberg in Germany, with a range of foreign experiences, including a long-term stay in Spain. The main focus of his academic interest lies in the resilience and adaptability capacities of different political systems. His research is dealing in particular with how states and governments deal with external and internal threats. Then we welcome Lena van Haren, recently graduated from the MA program in political science of Friedrich Alexander University. And she currently is active in the framework of GIZ, the well-known German Society for Development Cooperation, in the field of climate risk management. During her studies, her focus was on area studies and international relations, working as an assistant to the international relations professor and chair, and her practical experience also comprises activities, for example, with the Embassy of the Federal Republic of Germany in Bangkok, Thailand. Then Simon Zimmerman, a graduate of Friedrich Alexander University too, also with a master in political science. He was also enrolled during his studies at the Faculty for Economics and Politics of Cairo University. He is very much interested in state transformation processes, and he is now has a position at the Fraunhofer Society for Applied Research. And then we have Omar Arabi, a legal scholar, also student in the Euromed program of Cairo University, and very active in development cooperation. All right, so let me just give you some more information on the teams. So we have the pro-state team with Simon and Kulthum, and also Yara El-Maili and Rana, and the pro-market team with Florian, Yara Shaheen, Omar, and Lena. So now I want to hand over to the pro-state team, so to say, and we have the first round, which will be fought in inverted commas by Simon and Kulthum. So you may start if you want.
Thank you and good day. Welcome to today's debate. I'm not in control of the slides, so thank you. Good day, everyone, and welcome to today's debate. We will be arguing today about the shifted role of government in the ongoing global COVID-19 crisis. And to remind ourselves, our debate statement is this council agrees that the COVID-19 pandemic proved that big governments should be back. And if we stick to the definition of big government as a government with centralized political power, which is perceived as excessively interventionist in the public as well as in the private sector, and intruding into all aspects of the lives of its citizens, then the empirical evidence of the last year, it shows us indeed exactly this kind of behavior. The COVID-19 crisis forced nearly all governments. I will say next slide, please. But yeah, okay, you can stay on this slide. Thank you very much. The COVID-19 crisis forced nearly all governments around the world to resort to more and more interventionist and authoritarian measures in dealing with the pandemic. Be it extremely intruding maneuvers reaching from travel bans to border closings to the economic and social shutdown of public life in many, many countries around the world. Or, as we can see, the shifted role to a more invasive government. Also, you can see it in the increasing state interventionism, which can be seen in the trillions of dollars, which are now paid in subsidies, with which many states and governments from east to west are trying to mitigate the impact of the epidemic on their domestic economies. What we see in this pandemic is the recurrence of the central national government as the main actor in the public and economic domain. And some newspaper articles, they already spoke of a paradigm shift, which is occurring, and they predict the end of austerity era with the eruption of this pandemic. And in my opinion, all of this makes evident that governments now play a much more central role in the daily life of its citizens than they did in the years before. To further illustrate that, let me show you a worldwide index of government response. Previous slide, please. No, previous. Thank you. And a team from Hale Thomas, they calculated an indicator, a worldwide index of government's response with which to tackle the global pandemic. As long as there was no vaccine, according to the World Health Organization, the overarching goal for all countries in the world was to control the pandemic by slowing down transmissions and reducing mortality rate. Like, the best outcome is to get the pandemic under control before it even starts. What we can see here are different indicators ranging from containment and closure, from school closing, workplace closing, cancellation of public events, also to economic responses. And if we look on the next slide, please. On the worldwide distribution, you can see that the government response index level was pretty much the same worldwide. And it doesn't matter the regime type or geographical locations, like all government response in trying to cope with the crisis have been intense and intrusive, so to say, which is, in my opinion, a perfect example how governments responded. Interestingly, if you look into the worldwide infection rates provided by the World Health Organization, we can see that although it did originate in Southeast Asia, the pandemic proved to be a bigger challenge for the West than for Southeast Asia. And the question here, you might say, is like, how did Asia do it? Well, for most, the trust in big governance and in the capabilities of the state as a central actor is much more given in the population in a lot of countries in Southeast Asia. And this led to more general acceptance of invasive measures ordered by the governments to tackle the pandemic, instead of a major distrust in the state as an actor, as we have witnessed in many countries in the West. Also, as Southeast Asia was hit harder by earlier pandemics, such as the H5N1 virus, which is also called the bird flu. There were because of those earlier pandemics, there were national emergency mechanisms with a centralized body already in place in a variety of countries, such as in Taiwan. That's why countries in Southeast Asia were much more prepared. And as the massive scale of the pandemic became evident, most nation states were prepared and could respond in a proactive way and in a swift and timely manner. For example, let me give a quick example. Taiwan's response is a prime example in an efficient proactive coronavirus strategy. Taiwan had learned its lessons from this SRRS outbreak, and they established a national health command center and other units of public health emergency structures with which they relied on in the outbreak of the pandemic. This preventive and swift containment strategy can be seen in a lot of other cases, such in South Korea, Vietnam, and Singapore. And in each case, the national governments played an important effective role.
Just a little information. We have 5 minutes of the first round.
Okay, I'll speed it up in there. My main argument, if we can go 2 more slides. Thank you. My main argument in this case is, should big governments be back? Yes, prepared governments that took a determined and central, more proactive role in the beginning of the crisis were more effective in fighting the initial and further spread of the virus than countries under control of a reactive, passive government and a more coordinated, decentralized approach. And if we go to the next slide, therefore, my policy suggestions would be that countries need to set up centralized emergency frameworks equipped with broad but temporary powers. And once the virus is spread nationwide, harsh temporary measures seem to be more effective to fight the further spread than partial shutdowns of public and economic life. And these centralized emergency frameworks are more effectively exercised in the framework of a big government, as the timing and swiftness of responses is the crucial factor in fighting an imminent pandemic. Thank you very much. And I'll hand over to the next speaker, which is Kulthum, I think.
Thank you very much. Kulthum, you have now 4 minutes.
I will build on what have mentioned by Simon. First, by the definition of the government itself, it was reflected in different ways and in different acts of the different governments across the world. So despite the type of the government itself, they have more of a similar attitude regarding combating COVID-19. So first, I will talk about the central structure aspect of the government response itself. So we have seen 2 different ways in tackling this type of government response. First, some countries have appointed a coordinator or a single point of contact to articulate the national response horizontally across different sectors and across different ministries. We have seen that in Argentina, in Italy, in Latvia, in Egypt, in Colombia, in different countries, despite the government type itself. The second type of response in a structural way was appointing on development and an institutional and policy structure that performs the same function, actually, that performs the function of articulating the different response by the government across different sectors, including government and non-government entities as well. It happens in Chile, it happens in Australia, in Germany, and in Egypt as well. So despite the type of the government, there were extra role of the government illustrated in appointing a coordinator or establishing a central task force or a coordination mechanism that tackle the COVID-19 challenges in health and in non-health as well. And as a team, we anticipate that this, if well sustained in a good way, it will reflect on the national health system, that the health system will work in a more coordinated manner, in more central manner. We have witnessed a lot of working in silos in low and middle income countries, but this new way of working will make the national health system working in more systematic way and a more coordinated way. The second argument is increased reliance on the use of evidence to inform policies. Again, across different types of governments, there were more or increased attention to the scientific evidence to advise the policies regarding health or non-health issues, actually. We have seen it in different ways or different terminology to describe this function. We have seen a scientific committees, task force, panel of experts, scientific advisors, or whatever the naming of this job. We have seen it in Argentina and Spain, Colombia, and Egypt, and Morocco. Again, we anticipate if this practice to be sustained, so different domains in the health system, in national health system, will rely more on the use of evidence and increasing attention to these aspects of policymaking to be informed by scientific evidence.
1 minute left.
Sure. The third way is the communication with the public. It was very illustrated across different countries and across different types of governments. We have seen at very high level as the head of state or head of the government to communicate with the public. We have seen communication through portals, 24/7 hotlines, mobile phones, smartphone, and stuff like that. Again, despite the type of the government, we have seen this increased attention. And if sustained, it will reflect on the health system to be more into people responsive to their needs and their health needs. Thank you so much.
Thank you very much indeed for the first round of the pro-state arguments. And now we will see what the other side has to offer as arguments. So I'm already very excited for this. So please get started, the market-oriented team.
So thank you very much for the introduction. Now, when it comes to dealing with the COVID-19 pandemic, the role of governments worldwide have undoubtedly changed and increased. The big government seems to be the motto of the hour. And the often heard slogan, crises are the times of crisis are, times of crisis are the hour of the executive has once more caught the attention of many scholars of various disciplines. Now, but along with the increase in governmental powers comes the question concerning the effectiveness and the dangers of such an approach. On a closer look, several critical issues and possible risks can be identified, many of which are intertwined. As you can see on the slide, I labeled my part a multi-layered crisis because it is. Hence, I want to highlight the hidden risks that lie in the call for more big government in terms of effectiveness, as well as the erosion of core civil rights and the danger of democratic backsliding. Within my argumentation, I'm going to follow two avenues that speak against big government. First of all, protection of the political system and civil society within. And second, the scope and flexibility of the decision-making in terms of effective countermeasures. The concrete fear is that a devastating biological virus may translate into a damaging political virus that erodes good governance, damaging civil society, and progressively promotes authoritarian practices. Moving on. As I mentioned before, the COVID-19 pandemic fueled the accumulation of emergency powers in the hand of the executive. Evidence shows that incumbents not only in illiberal and authoritarian states, but also in democracies took systemically advantage of the increase in power in order to push their own agenda. This has led to an erosion of checks and balances, undermining the rule of law in the process, as well as the oppression of any regime, critical dissent of the opposition and civil society. Over the last year, 5 focal points of misconduct concerning emergency laws can be identified. These are, first, transparency. For example, denying of the severity of the pandemic or the critique of renowned experts who warn of the pandemic and dangers within. Second, infringement of free media and expression. For example, the introduction and the misconduct of new anti-misinformation laws. Third, the infringement of free elections. For example, the postponement, discrimination against the opposition, or circumvention of parliament. Fourth, the abuse of power by the security apparatus and courts. For example, arbitrary incarceration, political motivated verdicts. And last but not least, the restrictions on ethnic and religious minorities. For example, ban of religious rituals. And this brings me directly to my next slide. This map, which was taken from a recent study conducted by Freedom House, captures perfectly the detectable decline in democratic principles and human rights since the outbreak of the lethal virus. The shift, marked in orange, shows the impact of the pandemic. And with this in mind, I move on to my final argument. My last argument addresses the supposed edge of big government in terms of effective handling of the crisis. On first sight, the notion of quick and decisive decision-making from the top seems compelling. On a closer look, though, big government proved too cumbersome and inflexible in some cases to react adequately to fast-changing situations caused by the pandemic. Decentralized and integrated approaches, on the other hand, showed promising results in terms of effective countermeasures and intelligent crisis management. These approaches do not exclude the national government and its efforts from the fight against the pandemic per se, but rather offer a viable option to complement each other and come up with more nuanced ways of reacting to the challenges at hand. India is a prime example where both these things could be observed. While the national government was quick to impose a nationwide lockdown without taking the needs of thousands of foreign workers into consideration, thereby unintentionally contributing to the spread of the virus, several of the local states responded with better suited countermeasures to the threat. This included information campaigns, monitoring of infected people, and distribution of money and essential goods to wherever they were needed. Now, coming to an end of this brief input, the two arguments presented to you try to shed a light on the downsides and dangers of big government. So what's left to say? The emergency powers need to be checked constantly and bound to strict rules. And as for my second point, big government can be part of the solution, but at least within a broader approach that encompasses regional and local authorities, as well as civil society. And this brings me directly to my colleague, Yara Shaheen, who will give you a more detailed insight into civil society. Thank you very much for your attention.
Thank you very much, Florian. And we just move on to Yara to continue the arguments of the pro-market side.
Thank you, Florian, and thank you, Professor Alexander. I'm sharing my screen now, but you need to stop sharing first.
Yes. Bloody hell.
Okay. Just a second. So, as Florian have said, maybe I first have to start slideshow. As Florian have said, and all the colleagues have been discussing from the beginning, there is a call, every day there is a call for big government. And definitely we do need a big government, but most of the focus was on the need for big government and expectations from government. Yet during the same crisis of COVID-19, there were implications also in civil society. COVID-19 had prompted different civil society organizations to step into emergency relief roles to help manage the effects of the pandemic.
Yara, your presentation has frozen.
Is it now still frozen?
Now we can see it.
Now you can see it. Okay, sorry. So as I was saying, the impact of the COVID-19 was not only the call for big government, but also it has implications on civil society. And COVID-19 has prompted civil society to step into emergency relief to help manage the effect of the pandemic, building on the major access it had to different local communities, the trust and social capital that made it easier for civil society organizations to intervene rapidly and efficiently in many cases. Now, as we see in my second slide, there have been two types of interventions of civil society. The first type is in partnership with governments. reflecting the scope of the tragedy, a major tragedy, as we have seen, for example, the Médecins Sans Frontières building hospitals in Spain, Italy, and Belgium in times when Europe was the epicenter of the pandemic, bringing in medical advice, training, setting wards for recovering patients or those with mild symptoms. But there was also some other kinds of civil society intervention, which was to compensate for government failure and negligence. And we have seen the civil society coalitions in Brazil, for example, building temporary hospitals in local communities, working with local officials to distribute food when state failed to arrive with aid, when state aid failed to arrive to the right people on time. And they did this while working also with local officials. In India, in particular, an unplanned lockdown have left millions of migrant workers locked between state borders. And wide coalition of Indian civil society stepped in, setting kitchens, distributing sanitizers, doing awareness raising campaigns, and distributing personal protection equipment, PPPs, to frontline health workers, facilitating even cash transfers, and in addition to arranging transportation services for the millions of stranded migrant laborers when the decision of the lockdown was done totally haphazardly. All of this, and yet, if we look at this map that I have accessed this morning from the Civics Monitor about the national civic space ratings, and it looks at the status of civic space worldwide. And what do we find? We find that only 42 countries are rated as having an open civic space.
So 1 minute warning.
While 40 were rated as narrowed, 47 rated as obstructed, 44 rated as repressed, and 23 rated as closed. In spite of all of those contributions of civil society during the lockdown of COVID. And even going back very quickly to India, we find that in September 2020, India has passed an act that, while the government claims it's to strengthen compliance and transparency of civil society, it restricts civil society access to funding and threats its sustainability. Finally, while most governments welcome the role of civil society as service provider, as long as it aligns with its set policy and agenda, especially in such a context of a global trend of a shrinking civic space, nonetheless, civil society organization has a bigger role in shaping health policies by calling for increasing public spending in health and refuting austerity measures that had for years contributed to the deterioration of health systems.
Well, that time is
finally
2 more sentences.
Yes, exactly. There was a global coalition that has sent a letter addressing IMF strict fiscal consolidation targets in its loan programs. Despite the deepening global health and economic crisis, in Tunisia, the nascent democracy, a wide coalition of local and international CSOs launched the COVID Kills but Austerity Also Kills campaigns, which aims at affecting the policies of civil society over there. Finally, here's my conclusion. COVID has emphasized the need for big government, but this can only be achieved in a context of open civic space and vibrant civil society. Thank you.
Excellent. Thank you very much to all the presenters. And it was a very interesting first round, I think, with convincing arguments from both sides. So I just will also put me back on camera so that you can see me. We also started with a question in the opinion poll, the little brief opinion poll, asking, in your opinion, the role of governments worldwide has moved into more central during the COVID-19 pandemic. So the overall answer basically was really overwhelming 100%. And maybe there is not a big change in that attitude, but I will set on the second poll, and we can also add a little bit of tone and ask whether this is also the right direction. So the new question will also be tackling this. Okay, I will put out that poll now, and it's going to be the same question written, but also think a little bit like an evaluation of that into it. Is it good that we see that development into the into this development of the government? And I will open now the stage for the second round of discussion and the second round of presentation. Again, the pro-state team will start with Yara El Hamaili and Rana, and then we come to the pro-market team with Omar and Lena. So please, Yara, get ready to present. Thank you.
Yes, I'm ready. So the argument we have is that pandemic experience proved that the government intervention should be back, particularly in the area of labor market. In addition to health costs, the COVID has brought about a severe economic downturn that has taken a toll on living standards of millions of people worldwide. And one of the key transmission channels of the negative effects of the pandemic on living standards has been the labor market. Several problems occur here. In addition to an unprecedented degree of uncertainty, the private sector firms have faced a triple shock. The first shock is on the supply side, that has to do with the lockdowns and restrictions to individual mobility, and that have resulted in the shutdown of many businesses and limited the access to labor and other inputs. The second one has to do with the demand side, declining incomes that have reduced the consumptions to essential basic needs. The third one has to do with a financial shock that has hit a number of firms that have not been supported by banks or didn't benefit from the government assistance. For instance, if we look at the numbers, we can find here in this slide that 93% of employed resides in countries applying closure measures, and thus they're affected by the crisis. In 2020, 8.8% of global working hours were lost, equivalent to 255 million full-time jobs. These lost global working hours had two sources, either employment losses or reduction in working hours. Also, the global labor income have declined by 8.3%, and the lowest declines have been seen in Central Asia and Europe, because these countries have adopted retention schemes, whereas the highest have been seen in continents without schemes, such as the Americas. The argument behind the necessities of government intervention, as we said, is desirable in maintaining labor demand, supporting the labor supply, and improving the matchmaking process during the crisis. So concerning the demand side, the government is encouraged on the demand side by a provision of incentives for retaining employment and creation of employment. Two sets of interventions have been proven successful in various countries. The first pertains to the active fiscal policy and the accommodative monetary policies. For example, this was followed in several countries. For example, we see that the South Korean government announced a special support package with a budget of 20 trillion coronas in 2020. Italy has introduced tax breaks and waivers for social security contributions, as well as extensions of deadlines for repayments of mortgages. On the other front, the demand side policies may include lending and financial support to specific sectors, particularly the health sector. This has been witnessed in a number of countries. For example, in China, the government has set up a subsidized 300 billion yuan credit facility for producers of masks and other health-related items. And in UK, 5 billion sterling have been allocated to the National Health Services, while in Ireland, the government has allocated around 435 million sterling for the health service executive. In South Korea, the tourism and other sectors that have been affected badly have received increased subsidies and longer period of support, and of course here in Egypt the same. France and Germany together announced a broad approach to support all the sectors that have been affected by the pandemic. Concerning the supply side, the government should focus in two parts. They should be oriented towards providing incentives for seeking and keeping jobs, and providing incentives to help in human capital achievements. These interventions have been included in Germany and Italy and also China. And the third pillar is the matchmaking process. The matchmaking could be improved through a variety of packages, for example, job search assistance, employer intermediation, and counseling and monitoring. And of course, it could be a perfect timing for implementing the labor market information systems, particularly in developing countries. And this is what Egypt have been doing. Egypt have been working right now on implementing its labor market information system to be able to match-make the labor demand and the labor supply. And also in France and Germany and Netherlands, the government have concentrated their efforts on matchmaking, and this have improved the outcomes. So that's the part about the labor market, and I leave the room for Rana to tell you about how the government intervened in the gender aspect.
Thank you, Yara, and the floor is open for Rana now.
Thank you very much, Yara, and thank you everybody for listening. I will complement Yara's presentation and shed light on the gender aspect of the efforts that governments play to include the gender perspective. Basically, global data shows that women are the hardest hit group from the pandemic. They are subjected to domestic violence, they lose their jobs, they participate in unpaid care work, and all of these factors require a gendered policy response. And my intervention will shed light on what have countries done in order to respond to this effectively. Yara, would you like me to share the screen from my end, or would you be able to kindly support with the slides?
I can do whatever you want.
Okay, thank you very much. I will count on you then.
Okay.
So just to quickly wrap up what I mentioned, we looked at the UN Women UNDP global policy tracker. It's a tracker that was launched in 2019 to see what policy measures were taken by governments worldwide and ranks them accordingly. To look at the gender-sensitive policies. And the research shows that governments that were adopting these policies were able to recover faster from the impacts of the pandemic. And I shed light on examples from Egypt and Pakistan. In Pakistan, for example, the country has launched the largest social protection program in the history of the country, benefiting 66 million people. Women were disproportionately affected by the pandemic, and the government supported them by giving them scholarships for education. 50% of them were women beneficiaries. Related to public health and nutrition, a nutritional conditional cash transfer program was launched to support pregnant women and lactating women as well. Looking at the example of Egypt, where women are highly engaged in the public health sector. So, for example, we have 42.4% of human doctors are women. 91.1% of the nursing staff are also women working for the Ministry of Health. And in addition to 73% of nursing staffs in the hospitals and therapeutic facilities are in the private sector women. We can move on to the next slide, please. What policy measures did Egypt do? So, for example, backed with a very high political will, the president of Egypt announced the disbursement of exceptional bonuses for workers who are in quarantine, fever, and chest hospitals. These economic benefits have extended to women healthcare providers. The president of Egypt also instructed for additional support to the health sector and to enhance the financial conditions of the health workers, doctors, and nurses, and this also applies to women. Next, please. The National Council for Women in Egypt has also taken into consideration the psychosocial support and the psychological aspect and the mental health. So they launched supporting women's health programs for mental health. They also launched mobile applications so that women and the public can get the information that they need. They also provided personal protection equipment and sanitary pads and health tools for women who need the access also to family planning services within the pandemic was also particularly important. Next, please. I want to also say that based on the data from the global tracker.
So you have 1 minute.
Yes, I'm closing. I want to say that women, the global tracker shows that countries, for example, that have women's representation in the health response committee to the pandemic were highest in Europe, North America, Australia, and New Zealand. And this is also evidence of the need of including women and in designing gender sensitive policies. Also, Egypt is among the 20% of countries that include women in these national task forces. So to conclude all of the above that I just presented to you very quickly suggest that the government intervention is needed. So especially for women's issues and for the protection of women from anything related to the pandemic consequences, we need the big role of government and a very high political will and support. And this has been proven based on the data and statistics like I mentioned. So thank you very much, and over to you.
Thank you very much indeed to the first, to the second round team, so to say, coming up with interventions and replies to the arguments of the pro-market team. And now we have the second two participants of the pro-market position trying to underline their score in favor of more market rather than state. So the stage is yours, and you have also 10 minutes for your argument.
Thank you so much. I'm now also sharing my screen. Just give me a moment. So basically what I'm going to discuss is whether what the government has been offering is attractive incentives or a waste of resources. We've seen, as per the discussions that has been presented by my colleagues in here, that the government were trying to provide multiple attempts into providing support to its people. However, we can see that many of these incentives are actually rather insufficient or actually produces a waste of resources. Many attempts has been actually were presented that actually took us to insufficient packages and ineffective allocation of resources, whereby we can see that there were a number of offered relief programs. We can actually argue that the one-time financial grants to families and households were actually insufficient, because if someone has lost a job basically or being unemployed, these one-time payments actually were extremely insufficient, and they would have had to be presented in a different way. And through our discussion in here, our short presentation, we'll also get into that of how actually the poverty rate has substantially increased, despite the fact with all of these basically supportive arguments. But here, countering that, we can see that also some countries, despite the fact that they were actually attempting to support people, they actually took the complete opposite side as what happened in Egypt, that they have actually introduced a corona tax where they were deducting 1% from all employees and 0.5% even from those who are under pension scheme. And despite the fact with all of these resources, we can also argue that many of the governments should have actually directed more of these financial incentives towards building up their financial healthcare facilities, financially supporting their healthcare facilities in order to enhance its capacity and enhance its scalability of handling the pandemic. And this would have actually applied a further relief instead of people were actually looking around for healthcare support. And a consequence to that, we can see that in accordance to the UN Security Council, that is for the first time in 22 years, extreme poverty were on the rise during 2020, and this is deliberately connected to the COVID pandemic, and even the Fragility Conflicts report, as per the World Bank, that 1 in every 5 people in the Middle East and North Africa is actually now living in a close proximity to a major conflict. And this is actually, if people cannot find enough financial resources and healthcare support, this would take this whole problem beyond just an economic issue where financial support or just an economic support needs to be undertaken, but would actually turn into political and security challenges. So as a conclusion, as a matter of fact, what we can see here, that government has attempted actually to apply certain reliefs, but they were not properly implemented to our opinion, rather overwhelm the governments and actually put their people further in debt and cause the waste of resources given they were not properly utilized. Further effective solutions are necessarily needs to take place, and direction of more effective and enhanced way of building the capacity and strengthening of the government roles and capacity into just adopting classical solutions, where we can see that most of the government has been just doing is just to offer tiny kind of elements that would only make sure that people wouldn't disrupt against government, but just basically make sure that they remain quiet for a while, instead of actually addressing the root cause of the problem that actually led into a rise, an increase in poverty, and actually further affected the population. So now this will be taken also and further elaborated with my colleague Lena at her presentation. Thank you.
Thank you very much indeed. Perfectly the time, and now we can give over to Lena. So the floor is yours.
So I'll just need to stop sharing my screen.
To you. So now you should see my screen, right?
Yeah.
So in contrast to the big government arguments we've seen before, I would like to present the private sector and the markets as an alternative actor on the field of COVID-19 crisis management, which in some cases and ways is even more appropriate or even superior to the state when it comes to the crisis management in place. So what I'm going to present to you is liberal arguments against state intervention and rather in favor of private sector engagement in the political economy sphere. So my main arguments on behalf of the response phase of crisis management with regards to COVID-19 would be that entrepreneurial innovation is much more capable to come up with technological solutions in response to the pandemic, and that state intervention would rather disincentivize the development of vaccines and treatments and such. This should not be underestimated. So as we could see in some cases, like for example, for instance, more specifically, this was the case of South Korea, which had engaged a lot of private sector agents and actors to come up with testing kits and tracking software and apps and such, they were much more successful and even had the possibility to evade a countrywide lockdown. So this is a model that presents or prospects this on the case of Great Britain, where a scenario which involves targeted testing of symptomatic people would actually save not only lives and hospital beds, but also a lot of money, as 503 billion pounds would be reducted in GDP in comparison to a lockdown strategy. Another argument would be that the vaccines are actually the best way to get out of the COVID-19 pandemic, which is also not saving lives and hospital beds, but also saves a lot of money and budget, which is also good for the people living in those countries. So in contrast to a do-nothing approach, it would even save much more money and would just cost $2.5 per month per person, which should be the one strategy to go with. Economy-wise, I would argue that government bailouts of private companies, as we have seen at the global financial crisis of 2008-2009, state intervention in general will likely distort competition, limit incentives to innovation, unlevel the playing field, and even contribute to price inflation, which should be absolutely evaded. And otherwise, protectionist policies, which we have seen in the past by President Trump of the United States of America, will also likely harm global economic recovery, especially in countries such as Germany, which is highly export dependent. So as a conclusion, the policy suggestions I would make are that the state should enable private entrepreneurial actions, which are seeking public-private cooperation, as it has been done by South Korea, in order to come up with testing kits, tracking software, and technological solutions to the crisis.
I have 1 minute.
Yes, I'm closing, almost done. And instead of infringing on intellectual property, in the case of vaccine or treatment development, one would better engage the Health Impact Fund, which does not distort the logics of demand and supply. Furthermore, it would be much more useful to enhance social capital, institutionalization, and developing required infrastructures should be provided by the state, as in line with the classical neoliberal arguments. So to say, they build the baseline framework for public-private partnerships and private sector engagement. And last but not least, it should absolutely be refrained from government bailouts of private enterprises, as we could learn from past crises. Thank you.
Yeah, excellent. Thank you very much. So you really made it super in time. And now let me give a great thanks to all the presenters and their highly interesting insights, and arguments we could get. Let me briefly summarize. The first round of the debate started with pro-state arguments. Simon gave us a wide-scale approach with respect to the advantages of centralization and the positive effects which it has on policy outcomes, particularly in the public health sector. And Kulthum was building on these general insights and giving us a close-up look into the efficiency and effectiveness of a strong state intervention with respect to public health. The session then was followed by the pro-market arguments with Florian's warning of big government leading to possible abuse of powers and thus creating inefficiencies, and Yara Shaheen's focus on civil society as a more efficient, more successful, and less dangerous actor than big government. Then the second round, the round of replies and interventions, started again with the pro-state team. So we could get the arguments by Yara El-Hamaili with the economic benefits which arise from government intervention, and Rana was arguing particularly with the benefits to specific groups such as women, which would be beyond the scope of the market, and only the state basically can support them to attain their legitimate rights and benefits. The reply to that again was by the pro-market team, focusing on the fact that while the big government did actually act and perform, the impacts have not been really convincing on the long run, rather detrimental. And Lena, also using quantitative data there very much, showed that the market is by far more appropriate and efficient. I also want to put a view on the poll. So we had the second round of polling, and that was showing support for the thesis as well as to the question whether the development into the direction of the big state is a good development, a positive development. So 2/3 of the voters agreed with that statement, and 1/3 even agreed strongly with that. I will send out the last polling with the same question, whether big state involvement is not only visible, but a good way, the better way than the market may be. And then we will see if the last round of arguments had any impact on this result, which I just said. And now I would like to hand over to our official judge, Professor Theo Karis in Berlin. And we are all excited to learn about how you judge the arguments presented today. Did you find them convincing, for example? So you are on the air now.
Thank you very much, Professor Niedermayer. It has been also a great pleasure for me to follow the arguments and see their strengths and weaknesses. So I would like to start commenting on the presentations the same way they were done. So Simon starts with a very solid set of indicators that puts us directly into the problem, and I find particularly insightful his reference to Southeast Asia. Southeast Asia is a region of the world that has often been discussed as a strong state region, as, for example, Singapore is a highly developed country in Southeast Asia, but also not a democracy. So, and this is actually places Singapore in a very unique position in the comparative map of the world. And then after he refers to Southeast Asia, which is a region that actually exhibits the economic benefits of big states, then he does the comparison to the US and the very bad start that the United States have made in the alleviation of the COVID crisis. The United States is a liberal market economy, as we know it in the political science jargon, and therefore did not perform so well. So this comparison actually, despite the fact that the United States is the biggest economy in the world, makes this point very plausible. So, of course, the style of the presentation of Simon was a bit hasty, so this would be the only stylistic criticism. So Kulthum really followed up very well on what Simon presented. And I really like the fact that Kulthum connected comparative politics with public policy. So he presented different types of political systems around the globe, and they're similar actually responses. So the increase of state budget, the increase of market intervention by the government, despite the fact that we have a big variation in terms of typology of political systems, and she connected this observation very well with the importance of informed policy advice. Then we go to the pro-market argument. Florian made really some very powerful points, but what I missed in Florian's presentation, in Florian's part, were some more data. I mean, he mentions India, which I find very insightful, but it would have been much more convincing to know which variables, what are the exact policy areas that Indian central government failed and where Indian local government succeeded. I really liked, and then, so we continue then, and I also like the fact that in Florian's presentation, the role of accountability and democratic backsliding was very prominent. Then we go to Yara. Yara made this very important point about public-private partnerships, which in my opinion is also quite important and very important from a pro-market perspective, that in areas, for example, where the state cannot help the civil society or private sector with a public interest mission can intervene. And I really like the points about civil society coalitions in Brazil and India and MSF in Spain, Italy, and Belgium, but I would like to see more information about this. I know the time limitations, at least one of the two, for example, what are the NGOs that are involved in Brazil and India? In which regions are we talking? Are we talking in the capital regions, or are we talking in problematic regions like South India or in Amazonia in Brazil? Then we go back to what I consider the most powerful contribution, Yara's for the prostate, the big government case. It's labor market regulation by Yara Hamaili. Yara did an excellent job in dealing both with supply and demand side arguments to make us understand, to give us a very enlightened and solid approach on the role of information in labor market regulation, the role how governments under COVID conditions deal with unemployment, and also I mean the data that Yara presented are very convincing as well. At the same time, we have the follow-up by Rana. Rana made an interesting point about the role of gender, which I think is super important, but I found that Rana had too much text in her slide. And I really like the Egypt-Pakistan comparison, but because they have cultural similarities, but also economic differences. At the same time, though, I think that Rana should have focused more on this domestic violence, security, local and social security issue for women, and make it much more clear from cases. Of course, the point is super correct and relevant. So Omar, on the pro-market side, I think that Omar more or less started being in the right direction, but and I think that his implication that yes, for example, for big state is useful when we're talking about rich countries, but what about when we're talking about poor countries? Well, what happens when we're talking about countries that cannot really give a big financial umbrella to small and medium enterprises? I mean, he implied that issue, but he didn't really develop it as much, because I think this would be a really important selling point for the pro-market side. And also this definition of the global public domain. The global public domain is not just states, it's also companies, it's civil society, exactly what Yara mentioned, the pro-market Yara mentioned, Yara Shaheen mentioned in her point. I think that Omar could have done a much better job following up on this and actually talking about global regulation, global public domain, and the synergies. And also, as I said, maybe on another occasion, I mean, we're talking about vaccines and companies. We're talking about innovation. The whole COVID, from COVID transition era depends so much on companies and not on governments. And we have seen, for example, cases where governments funded private companies, like in the case of AstraZeneca, which was a UK-EU enterprise, or in the case of Pfizer, BioNTech, which was a Germany, EU, US enterprise. So companies can actually be areas for transnational and international cooperation beyond the logic of one single government. And this was not mentioned by Omar. Or Lena, I mean, I really loved her data, and I really liked the way she dealt with, she provided compelling evidence about the role of limited state and why, for example, it is not as useful or as efficient for big governments to regulate, bigger governments to regulate the COVID crisis. So I found Lena's presentation probably the most compelling from the market group. So thank you very much.
Thank you so much, Theokaris, for your very interesting and absolutely professional and convincing comments. So our official session time is coming to an end closely. So we have about 3.5 minutes left. So on the first thing I want to do is, okay, actually we have 3 minutes left now. I want to give you an information on the incoming results after the third round or second round of debate, the third poll. And before we had a agreeing to a positive role of the government, so supporting the role of the government by 2/3 and a strong agree by 1/3, and that has even shifted more in favor of the pro-government intervention role. So we have now 50% of the voters arguing that it's good that the government intervenes there with an agree, and 50% now compared to 1/3 before strongly agree that government should play a strong role in the overall handling of the crisis and possibly beyond. So we can see a very clear trend after this, I think, very enlightening discussion, and also both sides really presented their arguments, and we could see a lot of arguments in favor of the market, but obviously the arguments of the big government of trusting government entities despite the shortcomings we can see, we can read every day in the media about, is still, let's say, stronger than saying, okay, we can't leave it completely to the market, or at least to a large portion to the market. So we have 1.5 minutes. Is there any comment, any question by the audience? So you can see a session is ending in 1 minute 50 seconds. If there is any question from the audience, feel free to type it in the live Q&A. So at the moment, I don't see any question coming up. So obviously what we could see here is a really strong support in favor of the state, and to a certain degree that is also a little bit surprising maybe that the support is this strong given the public discussions we can see at the moment in the European Union, for example, in Germany, and in Germany with the super election year. We can also see an impact on the political party scene, but as far as our participants are concerned here, we can see a strong support, and that's good and very interesting. I am very happy that we could have that session. I'm grateful to the conference managers who invited us as a team, and I'm very grateful for the participation, for providing those strong arguments in any direction. Once again, a big thank you from my side to all of the speakers, also to Dr. Theokaris. It was a great event. Thank you so much, and hopefully next year we can do the same again.
I will be happy to.
In a live session. So thank you, everybody, also to the attendees. Bye-bye from here.
Thank you so much. Bye-bye.
Okay, so I think we are off the line now. Is it correct? So do we have to finish the session now?